guys, I am in Washington, D.C. as part of the American College of Gastroenterology Governor's Fly-In, where basically we have representatives from each state who are gastroenterologists representing our organization, one of the GI societies of 14,000 gastroenterologists, to help advocate for certain issues that are related to both our patients and the physician practices as well. And so I'm actually here in a different capacity. I'm one of the young physician leadership scholars. So last year I had applied and was chosen as one of these young physician leadership scholars for the organization. And that's why I'm able to tag along, because the organization wants to introduce us younger generation doctors to really be involved in advocacy and learn how to advocate for our patients, because not everything can be fixed with a change that's done in the hospital or how we perform our procedures. A lot of it has to do with the regulations and the restrictions that are imposed on us by the laws, both at the state level and at the national government level. So we are here in Washington, D.C. on Capitol Hill, and we focused on 3 key issues. So let me tell you about these 3 issues, okay? So today the schedule was basically entirely of meetings with representatives from the House of Representatives, talking about a couple issues. And the main thing was this bill called the HR 1570 bill, which basically was talking about screening colonoscopies. So to prevent colon cancer, it's recommended that everybody at age 50 generally, or if you're African American, starting at age 45, start getting regular colonoscopies or some form of colorectal cancer screening. We can take a look inside the colon and then potentially take out any precancerous polyps. Now, Medicare currently says that as soon as you find a polyp during your screening colonoscopy, they actually convert it into a therapeutic procedure. So it no longer is just a screening procedure. As soon as you, as the patient, wakes up from your procedure, you find out that you actually had a therapy done, and you can potentially get charged 25% out of pocket. So that really sucks, because clearly the way this law was enacted, it was meant to help protect the patient, get you screened for colon cancer or precancerous polyps, and potentially get them removed. And so now it actually may cost you something if you are relying on Medicare. The HR 1570 bill actually is backed with bipartisan support, but it hasn't been viewed with the priority that it deserves, and therefore it's just been sitting there waiting to be approved. And so we're trying to raise awareness about it again so that they can actually push it through that final process and get it passed. So the other issues that were actually brought up during our meetings with these representatives were things like step therapy. And step therapy basically is saying that patients have to go in a stepwise fashion through a series of medications before getting to like a stronger medication, for instance. Some patients who have insurance changes because of their employer or whatnot might have to start all over because they're bound to this sort of stepwise therapy type of thing. And it really sucks for the patient, because if they've been stable on this medication for such a long time, why would you ever want to change that medication and start with something when you know that you've been stable on it all this time? So if you get the drift, a lot of this has to do with insurance issues. And the other thing that we've been bringing up is this whole issue of prior authorizations. And I'm sure I'm probably going to be making a video about this at some point. But one of the things that we keep telling these representatives is that patients often have to undergo a waiting process before a medication is approved or a test is approved. And while this was meant originally probably with good intentions to help cut costs, it's really resulted in waiting for sometimes days on end before a medication or a test is approved. So that means not treating the disease right away, and leading to pain and suffering, and worse yet, surgery sometimes. And it also leads to a lot of time wasted. And oftentimes these things, after discussion with insurance companies, work out, but this is time and money that could be better spent. In order to handle the phone calls and the processing of all these, extra steps, there have to be more people hired to do this sort of thing, which is an additional cost. And limits the decision-making of the physician to be able to treat a patient with a stronger medication if we have to. And that's not to say that there aren't doctors out there who are abusing the system and using costlier medications when they shouldn't be, but that's only a small subset of the doctors that are out there. So those of us who want to practice medicine right and do it well and do it quickly feel like the process is just full of obstacles. And I'm sure there's going to be plenty that I'm going to be discussing on this channel with regards to obstacles in our medical system. So I was basically assigned with 2 other more senior GI doctors. We met with folks from the offices of Representative Scott Perry, Michael Doyle, Susan Wild, Dwight Evans, Christina Houlihan, and Connor Lamb. Everyone for the most part was super nice and took the time to really speak with us and listen, talk about their own personal experiences dealing with healthcare and the challenges that they've witnessed themselves or their families have gone through. So it was really great. In some ways, I think it was ironically reassuring that, you know, in this whole complex world of healthcare that we deal with, that they actually had a sense of, yes, that these were initiatives that were happening, and they knew that this was part of a greater picture of healthcare. You know, often some of these issues are just one example of certain similar situations happening in other specialties as well. So they're not entirely foreign to this if it's being mentioned over and over by representatives from other medical organizations. And over lunch, we also had several representatives themselves come and speak with us. Two of those doctors that really stood out. One was Dr. Kim Schreier, who's actually the only female doctor in Congress right now. Super inspiring. The fact that she took the leap from being a pediatrician and taking time off to run for office. And then we met with Dr. Bill Cassidy, who is a senator from Louisiana, who gave us a really interesting perspective because he actually is a gastroenterologist by training. So he really has firsthand experience with the things that we are discussing. And he actually continued to practice while serving in government up until only 3 years ago. And he's been doing this for, I think, like 20 years or something. So it's pretty awesome that he's been actually advocating and making change on this end of things. These are the people that we need to approach to really fix the law and fix our health system. So I hope to also look into this more, learn more about the whole process, not just on the national level as I'm doing now, but also at the state level. But anyway, I'm gonna leave this video at that. If you enjoyed this video, please give it a thumbs up. Don't forget to subscribe. You can follow me on all my social media channels at Austin Chang MD, and check out my website, austinchang.com. All right, I hope to see you guys soon. Until the next video, bye.